Hello, today I'm going to be talking about the blood flow through the heart. I'm going to start off with this small introduction of the cardiovascular system before I start going into the cardiovascular diseases and things like that. The heart is basically essential to living and one of the most important organs in the body, although not the most important. And therefore it's important to know how the blood flows through the heart so you can get unoxygenated blood to the heart and then have it oxygenated and return to the rest of the body. So as you can see here, we have the heart. It has four chambers. We have the right atrium and the left atrium, the right ventricle and the left ventricle. So these are basically the chambers that pump the blood to the places the blood needs to go. So I'll explain the blood flow now, and I'll try to be descriptive as I go along. So you have here the superior vena cava and the inferior vena cava. That's not marked here. But basically, the blood from the head, the upper extremities, would all end up in the superior vena cava, which goes into your right atrium. And all the blood from the lower parts of your body, like your legs, your torso, etc., will go to the inferior vena cava and go and be pushed into the right atrium of the heart. So this is where all your blood ends up. At this point, your blood is unoxygenated. The oxygen has already been used up by the rest of your body. So from the right atrium, the blood will be pushed to the right ventricle through the tricuspid valve, which is right here. And from the right ventricle, your blood will be pushed into your pulmonary artery, which is right here, through the pulmonary valve, which is right there. So all your unoxygenated blood will go to your pulmonary artery into your lungs, and this is where your blood picks up all the oxygen before it can return to the heart. So it returns through the pulmonary vein, here and here, here and here. And through your pulmonary vein, it will go into your left atrium, which is right here. And then at this point, your blood will be pushed down into your left ventricle through the mitral valve, which is right here. And finally, your oxygenated blood will be pushed from your left ventricle, very important, through your aortic valve into your aorta. And at this point, your blood is dispersed throughout the rest of your body. So now I'm going to explain how where the lub-dub sounds come from. Anyone who has ever listened with a stethoscope to the heart or heard on TV, you always know that you hear the sound lub-dub, lub-dub, lub-dub. This is basically the valves of your heart closing that's making that sound. So initially on the lub, your tricuspid valve here and your mitral valve are closing. So your right atrium here and your left atrium will squeeze at the same time, pushing the blood into the right ventricle and left ventricle through the valves. And when they close, you hear lub. So there and there. And then your right ventricle and left ventricle will squeeze at the same time, pushing the blood into the pulmonary artery and the aorta. So this is the dub once those valves close. So that basically ends up creating the sound lub-dub. Lub is the first sound. It's called S1, and dub is the second sound, called S2. I'll go further into the other heart sounds in future videos. So that's it for now. If you have any questions, please leave a comment.